My name's Alan, and my child's name is Kevin. We live in Pasadena, Texas. Kevin has been diagnosed with severe autism. Kevin was diagnosed about 2.5 years old. Kevin is nonverbal, he's very aggressive, he doesn't have a whole lot of tolerance for anything that, any types of weight or any types of what he feels like is an inconvenience. So, if Kevin were able to go to events and sit and be patient and wait and things like that, if he were able to communicate his needs, and I think that's a big part of why he gets frustrated, is he doesn't have the ability to tell us what's wrong with him, whether he has a headache, whether he wants to go outside. He does a lot of pointing and gesturing and things of that nature. We'd like for him to be able to communicate his needs, better than he does today, whether that be, preferably verbally. But if we can improve his skills with using cue cards, iPads, anything like that, that would be helpful for us. So we'd really like to get to the point where him being able to communicate, also he's able to interact and learn more, like computer-based programs and things like that might be available on an iPad, or something to keep him busy, which I think would reduce some of the frustration. That's a good question, because initially when we understood there was something different about Kevin, we went to our doctor at that time, and he just kept telling us, hey, kids develop later than others, and he'll be okay. And we really had to self-diagnose. I actually was watching a football game with Doug Flutie playing, and they panned up to the stands and showed his son and his wife and mentioned that his son was autistic. And then I noticed his son was doing his hands like this, and immediately chill went down my spine that I knew that something was wrong. So long story short, I really don't know. I don't know if it's changed. I don't think that it probably has, but I don't think people really understand right away what autism is and what to look for. I think it's become a catch-all for a lot of things, but as far as an accurate autism diagnosis, usually the school district is going to have to do something like that, and not really necessarily a physician. As far as the therapy they offered in school, he did get some of that, because I think at 2.5 they put him in, I think it was PPCD they call it. He started there. The real issue that comes out of all the diagnosis early on is that you're put in a situation where you don't know where to turn, because it's most people that have kids who have autistic kids become isolated, and they don't get out in public a whole lot. So you're not meeting a whole lot of people that are a reference point for you to be able to say, hey, what was it like with your kid? Because there's no really way to connect with those people. The waiting lists that are out there, once we did find somebody that had an idea that there were waiting lists, Kevin was already down the road a little bit. He was 4, 5, 6 years old. And then and our understanding is most of these lists have been, and not just understanding, it turned out to be true, that most of these lists are at least 10 years long. So he's, 15, 16, 17 before he gets any type of help. And then after that, they term out pretty quick, because once you become an adult, that's a whole different start over point for a lot of these programs. Kevin's on the wait list for OT. He's been on that list for 10 months. As far as speech therapy, we've been receiving that. We were getting it twice a week, but we're getting it once a week. And just to say, at twice a week, it would have been nice to have it a little bit longer intervals to help with Kevin, him being nonverbal. Being on the wait list is really, really frustrating and tough. All the families that are on these lists, it feels like it's an endless list, that we have no idea when our name's coming up, what we're going to be able to get when it comes up, or even if the programs are going to exist by the time they do come up. That's highly frustrating, and for all of us out there, just looking around for everything we can, whether it be sacrificing our career to stay home to whatever therapies we have available. It's just tough for us right now to be able to count on managed care, because we have no idea how well they're going to be able to live in the future. I'll use the word again, isolated. I just felt like that there was no hope, that the list was so long. Well, everything that I just mentioned, once I heard the other people that were on and they had older kids, they told me that, hey, look, it took this long, and you're going to have to make do until then. I think the school districts are wound up being overtaxed with these kids, because a lot of what happens is they get these kids and they'll have maybe one qualified teacher, who has the training, and then you have to get aides and things like that. that aren't trained very well. And I'm going to tell you, signing up to get a severely autistic kid with aggressive behaviors and getting paid not very much is not something a lot of people are going to sign up for. So I think there has to be a lot more out there to assist not only the parents at home and in-home training, and not only just training them for things they should be learning in school, preparing them for a better future down the line where they're able to live if it's an assisted living facility for the people that once my son leaves our home, for him to be able to go somewhere else. There has to be help along the way from parents who are trying to work and deal with a kid that needs 24/7 care and all that stuff. And there's nothing to connect all that and say, the school has this piece, the family has to do this piece, and then I have another agency when he's at my house that's helping me do our piece. That doesn't really happen, and that's been a real big problem for us. Bits and pieces, you get some help, but they're, and then you're putting these kids out here that wind up in institutions later on and costing the government money down the road, and that's, some of that could be prevented if they were helped a lot more when they were younger. And even there's no giving up on them. My son's 20, and I think he has the ability to learn more than he knows today. But there just has to be more funding and more help and the right kind of people that understand what's going on. Because like I said, this is not the easiest job. God bless anyone who takes it upon himself in this line of work, because it's very, very tough, because these kids are challenging, and there is no one game plan that you can put for every kid and say, if I do A, B, C, and D, I'm going to have the same effect across the spectrum, because that won't happen. So you have to get people you have to get the training, and you have to have the money to get the training. And I just think there has to be more out there for such a condition that is spreading like wildfire in the United States. And there are just more and more families like ours out there that aren't getting the help that they need. And it saddens me that I hear that we're going to get less help. I'd say that they're misinformed, and I think that's because it's part of the problem with autistic children. I can walk out the door right now with my son because he looks perfectly normal. He looks like a blonde-haired, blue-eyed surfer kid. That people don't understand what's wrong with him until you'd have to be around him a little while, engage with him. But there are people that are on the mild end of the spectrum. You couldn't tell. I know a kid that lives down the street that's autistic. Has a job, works at PetSmart, won't drive a car because he cannot handle all that commotion and things like that. I just don't think that they understand the lives. I mean, I think, I'll tell you right now, I watched Rain Man before Kevin was ever autistic, and I thought every kid was going to be like Rain Man. I thought when they told us he's autistic that he was going to want, I could take him to Vegas. Not that I would do that, but I could take him to Vegas and he could, count cards. It's a very complex condition that varies by child, diagnosis by diagnosis. There is no cookie cutter mode. There's nothing about autism to say that it's gotten better and we need less help. So if anybody thinks that they need to cut money, that's the exact opposite. There are people sitting out there that are struggling. If you look at my arms, the scratch marks and all the stuff on here from Kevin's aggression, that's real. There are people living that life out there that when they hear that type of news, they're just devastated. To date, no one has come to us for managed care. I haven't. Most of my friends, I haven't heard that they've had the same, have an experience with managed care coming out to them either. There maybe it's a provider. I don't know. But to this date, nobody's really contacted us or made us aware of any programs or anything out there that would be helpful. Yeah, we've done that, and I think they're overtaxed too. There's just so many people on those lists, and it's just tough because it's not a list that's even rhyme or reason, because you could have a really severe kid that just is in crisis mode and you get no help. It's just what your number is on that list, and nobody's coming to us and sitting down individually and qualifying what the needs are, telling us when he gets to this age, you're going to need these services, and us saying, based on this list, we're not going to even, we're going to be beyond that. I think that's a lot of the problem is there's got to be a game plan between Medicaid, Medicare, us, the school district. I keep mentioning the school district because they're having to educate these folks. I just think there's not a whole lot of that out there, direction out there. We're all lost. Yes, I did know that. I do know that. I don't know exactly what they're obligated to do, but I know that they're obligated, to through Medicaid and also through the school districts, and they're obligated to educate us. And wow, I would say that's an overstatement. I think it's very difficult. First off, even to get to go to a primary care physician, and with all the types of things the behaviors that some of our kids have, to have them even sit in the waiting room as long as they have. Lots of those folks don't want us in those positions in their practices because some of our kids are disruptive. It's tough for us to go to just a general place. There should be more specified help for us out there, and it just isn't. Well, the first part of that would be finding out what we're eligible for. The second part would be if these agencies that do provide services are even not booked where you can get them. The other thing is, how much do you get? And that seems like it's been less and less over the years, and the problem is, these folks, my son is never not going to be autistic. That's something I had to come to grips with a long time ago, and it's one of the hardest things for any parent to sit down and say, my kid's not going to be an athlete, president of the United States, or any of that stuff at a very early age. And you have to tell yourself, okay, we have to move forward from here. The problem that we really have, this community has, is we don't have a whole lot of tools to do that. And a lot of people are financially bankrupting their family, having to go out and try different things, because I think I said before that there's no one path. It's not like having cancer. If you have breast cancer, they have a regimen for that, a drug regimen for that. And you don't have that in autism. You have to try a lot of things. We've tried a lot of different medications with Kevin that some of it made him gain weight and things like that. It created other problems with him. We really don't have that back and forth with anyone to say, here's the types of therapies that are out there. It's like, hey, I'd love to have an autism one-on-one. Sit down. Okay, your kid's autistic. Boom. You're eligible for this, you're eligible for that, you're eligible for this. We tried these drugs, we tried that drugs. It is all do it yourself. Sign up for what you can. You may be able to get this and you may not be able to get that. And you may not be able to get these services very much longer because they're going to cut them. You're dealing with a group of people, a subset of people that not many people know about. I've said this before. I had two lives. I had one before my son was diagnosed and one after. I should say my wife and I have two lives. There is a huge need for us to feel like we belong in society because we've been pushed aside, and whether it be our interaction with other people or it would be just going to the doctor and getting treatment and therapy. No one really understands our community, and none of us want sympathy. We want empathy. And if there's a possibility that more people could sit down at the table with families like mine, which there are just millions of them across the United States, and just explain to them what the path forward is for us, because we don't know. We're all struggling and trying to do the best we can, and second guessing every judgment that we make. If we decide to put him on a different drug or whatever, but we just don't have the interaction with the scientific community to be able to make the right decisions, and we're making them on our own, and we're having to do a lot of guessing that could lead to health issues for our children down the road that we're going to carry that guilt for, and we're really just trying to do the best that we can. We appreciate anybody that's willing to listen, because I'm going to tell you, but like I said before my child was diagnosed, I didn't know anything about autism. I walked past people's kids. I probably thought they were just misbehaving or whatever, because I had no idea. I live the life now, and I know, and all we're trying to do is educate other people around us to know that these children are different, and they need help, and it may not be apparent to you by looking at them or comparing them to other people that they are different and do need intense therapy, but they do. Well, I'd like to say with Medicare, first off, I want to thank them, because Kevin doesn't always take to everybody that comes out here, and it really takes somebody that's got specific training and an understanding of people like him. Our experience has been with Medicare is that when they've come out here, Kevin has bonded pretty well with them. I think the interaction back and forth between the therapist and Kevin has been fantastic. He doesn't always engage with people, and he's done that, and I think he's made some improvements along the way. She's certainly patient with him, and whenever he has any types of behavior moments, she doesn't run away from him, which we've seen in the past where some folks, based on the type of behavior he has, don't want to come back, but that hasn't been the case, and she's been wonderful.